Yeah, it's been live streamed.
Live.
Sure. Okay, so can I start?
Yeah, we can begin. We are live and on first runner up.
Okay.
This camera.
Okay. Good evening to those joining us now live. Got it. Okay. Good evening to everybody joining us now live. You're all welcome to this very special live session where we're going to actually have a campaign and on sickle cell anemia. My name is Atemnuela. I am a social entrepreneur and a beauty queen, and currently first runner up Miss Southwest, and I am advocating for sickle cell awareness. Today we are going to have someone here. We're actually with someone who is going to share more insight on the sickle cell anemia disease, and I'm going to try and find the words to properly introduce him because he's okay. So a Kongafeni Cynthia Chindange is his name, but commonly known as Gentle MD. He is a medical doctor and a finalist for Mr. Cameroon for the United Nations and a clinical UX specialist. So he's also a citizen journalist, aspiring leader, an author, brand designer, and social change agent. Dr. Cynthia is the founder of the Cynthia Research Academy, a science-oriented research community aimed at breeding innovation in the field of scientific research. And his team and himself have been able to empower over 300 Cameroonian youths with research and data analysis. And he is serving as a medical doctor at the Cameroon Baptist Convention as in charge of non-communicable diseases, and it is on this base that we have him today as a resource person because he's going to give us more insights on the sickle cell disease and how related is it to non-communicable diseases. So Dr. Cynthia, if you're there, we would love to hear a word from you.
All right, thank you very much, Ms. Atemnuela. I'm here 515.
Thank you very much for being here with us today. So we'll just go straight into our topic for today, and we'd love to get your opinion and more insights on some of the questions we have today to properly educate the public about the sickle cell disease. And I would love us, if it's possible, if you can give us tell us more about what is the sickle cell disease, what are the symptoms of the sickle cell disease, and how is it diagnosed?
All right, so thank you very much. Sickle cell disease is simply a hereditary disease, and it's an abnormality of the red blood cell. Since we are reaching out to the entire population, to the world as we're talking, I'm going to try to make it very, very simple, basic, moving all the technical words. So when we say someone has sickle cell disease, it means the person has a genetic disease that is due to an abnormality in the red blood cell. All right, so basically that's what sickle cell disease is in very layman way. So that's how we keep it simple. The other technical words, but it's just someone who has a genetic disease. It means he inherited from either mother and father. In this case, it will come from both parents, and it causes an abnormality in their red blood cell. And this abnormality is the fact that the red blood cells are no longer round in shape. All right, they become sickle. That's why the name comes. It becomes sickle in shape. Sickle looks like the shape of a crescent moon, which we see most of the time. So basically, that is what sickle cell disease is.
Okay, thank you very much. So how can one get to know if they have sickle cell anemia? How is it diagnosed?
All right, basically, the disease is diagnosed by what we call hemoglobin electrophoresis. That is a test that is done to identify your your genotype, your blood cell genotype. And the normal, it's called the AA. Someone who has sickle cell anemia has SS, so he has hemoglobin genotype SS. Now, someone who has what we call the sickle cell trait, meaning the person is a carrier, he has hemoglobin AS. So we have, when you say you have sickle cell anemia, you should have both SS genotype in your blood cells. So basically, we do the hemoglobin electrophoresis and we diagnose people who have sickle cell anemia as having hemoglobin SS. Basically, that's how we diagnose that. So if you have hemoglobin SS, then you're sickler. Otherwise, you don't have, or you have AS, it means you're a carrier.
Okay, and what are some of the symptoms with those having the SS genotype? What are some of the symptoms of the sickle cell anemia?
All right. So typically, since it's a disease that comes from when you're born, these people will manifest. This person's living with sickle cell anemia, they'll manifest with a lot of pain. Disabling pain, we call it disabling pain. Why does this pain happen? It's because the red blood cells don't carry enough oxygen to the target organs. And most of these organs are the long bones, means your limbs, okay? So they present with excruciating pain. That is the first manifestation, all right? For children, when they are born, if mothers are keen, mothers who are following, by the age 6 months, we have what we call the hand and foot syndrome. And what happens? They have swollen hands and feet. And that is like what we call the first pathognomonic sign that will make us want to do the hemoglobin electrophoresis to a child who's just 6 months old. So basically, those are the early manifestations. Now, as these children grow, all right, aside from the pain, they are prone to a lot of infections. They are prone to a lot of infection. That is because as they grow up, their immune system is damaged with what we refer to as autosplenectomy. The spleen is deleted. So what happens is that these red blood cells, which are sickle in shape, instead of having a lifespan of 3 months, like the normal red blood cells do have, they have a lifespan of about 70 days maximum. And so the spleen is the organ that is in charge in recycling this red blood cell. So with time, so much damage is caused to the spleen, and by age 5, the spleen loses its function, and that's what we refer to as medically autosplenectomy. And these children are prone to infections, right? And so you find them always sick. You find them always coming in with recurrent infections. Another thing is because since these red blood cells have a shorter lifespan, these children are going to have they're going to need recurrent transfusions because they are always anemic. And that is why the word is called sickle cell anemia. That is because these people actually are having shortage of blood. Now, the next manifestation of people living with sickle cell anemia that you want to always pay attention to is the fact that aside from them being always anemic, they have some faces, all right? They have some faces. They have some faces, like you find children with, we call it parietal busting. So their heads are a little bit enlarged, or the skull is a little bit enlarged. They have prominent seats, all right? Their eyes are almost always yellowish. So those are some faces that these children manifest with, and you can easily know that, okay, something is wrong with this child. Let's check. And one of those things you want to check is actually their hemoglobin electrophoresis. You're muted.
Thank you very much, Dr. Cynthia. Okay, you mentioned something about pain, and I'm sure, as myself, the viewers also want to know, is it pain, like what part of the body? Is it like every part of the body it can have, they can face the pain or have the crisis from or any part from the body? And also, as a doctor in charge of NCDs, non-communicable diseases, how prone are those suffering from sickle cell disease to some non-communicable diseases? What's the risks?
All right, so those are two questions embedded in one. All right, so I'm going to I'm going to take the first one. Where
Okay.
does the pain, where does the pain occur? Where does the pain happen? So more often than not, this pain is always manifested on the limbs, the long bones. So the forearm, the arm, the legs, okay, the thigh, always have excruciating pain there. All right. That's because what happens is that these sickle-shaped red blood cells, they cannot flow as fluid along the veins or the arteries, and so they get blocked. So if this happens in the long bones, each time there is oxygen that is not circulated to that part of the body, and this manifests as severe pain, really, really disabling pain. And basically, that's most of the times where they manifest. Another side is chest pain. Most of them also manifest with a lot of chest pain. We call that the medicine acute chest syndrome. And it's also very disabling. They actually have difficulties breathing when pain happens in the chest. So basically, those are the common sites that you always have people living with sickle cell disease manifest with painful crisis.
Okay.
Now, turning to your second question, the second question was, what are the non-communicable diseases that these children are prone to, right?
Yeah.
Great. So first, I want to say what non-communicable diseases are. So non-communicable diseases in a layman way, just as the name says, it's basically diseases that don't communicate. What does that mean? It means it can't jump from you to me or from me to you. They are not contagious, all right? That's what we mean by non-communicable diseases. Examples of these diseases are, we have cardiovascular disease, that means heart and blood vessel diseases. And these are the leading class of non-communicable diseases that are leading death, mortality globally. We have another group which refers to as cancers, right? So common cancers that you know, breast cancer, prostate cancer, you can name the rest, fall in this group. We also have respiratory diseases, all right? Respiratory diseases, we have things like emphysema, we have chronic bronchitis. We also have asthma that can be put in this category, that can be placed in this category. And then another class of non-communicable diseases are actually metabolic diseases, diabetes, which is one of them. And also we have a non-classified, a fifth group where we have very rare diseases that occur, but they are not transmitted between man to man, and are actually obtained from risk factors or by virtue of our genetic makeup. So people living with sickle cell are increased risks of mainly cardiovascular disease. Why is that? Because it is primarily a genetic disease that is associated with an abnormality of the red blood cells. And so the red blood cells basically, they flow through their blood vessels. Now, what does this say? These children, they are exposed to having strokes at very early ages. So as a medical doctor, if I find a child with a stroke, I want to do their hemoglobin electrophoresis right away. Why is that so? A stroke simply means there's no blood supply to the brain. So it's very simple to happen. The sickle cell will run and get into a blood vessel in the an artery in the vein in the brain, and then block it. And so if that happens for a sustained period of time, that part of the brain that supplies the part of the body that is affected gets paralyzed. So that's what happens. If this happens in the heart, children will have a heart attack. If it happens in the kidneys repeatedly, they get to kidney failure. And this is actually what happens in the spleen. By age 5, the children have what we call autosplenectomy because of recurrent infections, recurrent damages that are caused in the spleen. So the main the main non-communicable disease that these children are exposed to by virtue of the fact that they are living with this genetic abnormality, it's developing cardiovascular events, strokes, heart attacks, kidney injury, and you can name the rest. All right. They also have wounds that don't heal. They have wounds that heal poorly. All right. That is because the blood vessels supplying the limbs, most in particularly, have been damaged with recurrent infections, recurrent damages that these blood cells comes and block the arteries. And when this happens, blood supply to the wound that happens would take so much time to heal. And basically, that is it. So poor wound healing, it leads to peripheral arterial diseases, and they have strokes. Now, because these children are sick, they are termed sick because they'll not be allowed to go about their daily activities. They tend to be sedentary, and this predisposes them to other risk factors of cardiovascular diseases like diabetes, because being sedentary, you are at risk of becoming obese, less active, all right? So these children are as well exposed to these lifestyle changes that can increase their risk of having other non-communicable diseases that would affect them and compound their well-being or their quality of life.
Thank you very much, Dr. Cynthia. So I'd love to ask, is there, so far we know of the test that can be taken to determine if you are a sickle cell carrier or a sickle cell, living with a sickle cell disease. We'd love to know, are there any medications or is there a treatment for sickle cell anemia?
All right. So children living with sickle cell, actually, we encourage everyone to enroll in a sickle cell clinic. All right. And we have actually a follow-up for these children. So first of all, like we said, it's an abnormality of the red blood cells, and the red blood cells are damaged earlier on. So these children are constantly on what we refer to as folic acid. This is to help the bone marrow manufacture more red blood cells as they keep damaging. So that is the first routine medication that these children take for life as of now. Now, next we have, under the age of 5, we have drugs like hydroxyurea that is also given to the children. We have malaria prophylaxis as well, since we're in a malaria endemic zone, especially in Africa. And the reason for this is because malaria targets red blood cells and it damages really, really, really fast. And so we want these children to be as malaria-free as possible. Now, the children are also vaccinated against what we call encapsulated bacteria. These are bacteria that are protected against, that are being defended by immune cells manufactured by the spleen, which is damaged most of the times by age 5. So we do this to these children so that they get vaccinated so that they are not exposed, or they and the diseases are not very severe when it happens with them. So basically, that is routine care. And most of the times, we encourage children like this to always stay hydrated. First of all, these are lifestyle adaptations. They should stay hydrated. So staying hydrated will prevent them from having recurrent painful crisis. The next is to avoid unaccustomed activities. All right, unaccustomed activities like sports. This is because it demands a lot of oxygen, and with low oxygen tension, the sickle shape of these red blood cells are actually accentuated, and they manifest, and it increases their risk of having crisis. Now, temperature changes like cold weather will also trigger crisis. So we want the children during cold weather to keep warm, right? And also when you are exposed to very extreme temperatures, you become dehydrated, and this also increases their risk of having crisis. So Bosomodo, these are medical ways of maintaining their lives, and also lifestyle adaptations. Persons having children living with sickle cells, and as well as a person living with sickle cell disease could adapt to ensure that their quality of life is very, very healthy. What will I say?
Okay, thank you very much, Dr. Cynthia, for explaining that to us. In the course of your explanation, you kept mentioning children below 5 years, below age 5 years, and you also mentioned clinics, sickle cell clinics. So here's my question. Is it that for people living with sickle cell above the age of 5 are totally free from all the things that you said, or are not supposed to take into considerations all that you said? And also, do we have those sickle cell clinics here in Cameroon where we have those sickle cell patients come together for regular checkup and all of that?
All right. So why I mentioned age 5 is because most of the changes happen around that time. But people above, we have people living with sickle cell who are in their late 40s, right? So yes, they'll get these manifestations, but the real transition where care has to be really taken is when we are still under the care of our parents. So that's why I kept on emphasizing. Now, yes, we have sickle cell clinics, all right, in the country, and we have people living with sickle cell in the clinics above age 40. And yes, these people are coping with the crisis. And for example, here in the Cameroon Baptist Convention, here in Yaoundé, we actually have a sickle cell clinic at the Tukebe Baptist Hospital, which has a very large cohort of people, and their follow-up is really, really commendable. And so for everyone who is around Yaoundé, you want to visit the Tukebe Baptist Hospital to actually follow up there. I didn't get the second part of your question. Please, if you could take it back.
I think you answered the two questions already. The first was about the age group, and the second was about the clinics. But also I'm going to I have a question. I think we should actually tackle that. Looking at what we are facing now, the COVID-19 coronavirus, I think it has a relation. What is the relation between those suffering from the sickle cell disease, and also with the vaccination? I think the vaccine has been out for some time now. Do you think it is safe for those suffering with sickle cell anemia to go ahead and get vaccinated? Because I think it has to do with the cardiovascular and non-communicable disease. Yeah. So I think you should shed more light on that.
All right. So I would say that in current times, people living with sickle cell disease, if they have the opportunity to get the vaccine, they should, because this is going to prevent them from having increase or higher severe forms of COVID-19. Now, from its inception to present day, we have recorded that people living with non-communicable diseases and chronic diseases, not excluding sickle cell disease, are at increased risks of severe forms of COVID-19. So if you're in the country and the vaccine is available, you should be able to get that. This is because it's going to prevent you from severe forms of the disease. And basically, if I would advocate anything, it's that those of us living with these chronic diseases should actually be the persons prioritized to get these vaccines, because it's going to help them stay healthier and longer.
Okay, thank you very much. And to add, I think everybody watching us now, if you've not had probably your vaccine, if you're not taking your vaccine, you should actually take into consideration, because it's something that we should look into, because we are worried about our health, we are worried about our safetyness, the life, the health of our loved ones. So when we say vaccines, it's not only for some specific people, because we all are prone to getting the COVID-19. So yeah, okay. I think Dr. Cynthia, do you have anything to add?
All right. So what would I want to add to our followers? It's that we live in a time when we have to be able to support each other to live in a sustainable world. Now, yeah, it's a pandemic period, and it is the first time that the world is paying attention or prioritizing health. All right. And the platform we find ourselves in, it's actually a beauty platform. and we are promoting health. I, as a health professional, I, as a medical doctor, I am into this because I want to use this as another platform to get the attention of the world to promote health in a more serious way. All right. It's very interesting that we are into a fashion show. But in the fashion show, we are talking about helping a very neglected population, people living with sickle cell, and more to that, even people living with sickle cell and non-communicable diseases. So even as of now, the leading cause of mortality globally are non-communicable diseases, notably cardiovascular diseases.
Yeah.
So as we are talking, we are in a pandemic, in a COVID-19 crisis, but it's not the leading cause of mortality. What does that call to our attention is that we should pay attention to what I call the silent pandemic. It's going to pick us up in a very rapid time. And I will tell you that I have 25 years old, 26 years old, 30 years old, living with hypertension, diabetes. Some of them have had heart attacks. Some of them are also living with kidney injury. And it's a pandemic that none of us are seen coming, but
Yeah.
I'm using this platform to raise awareness to those persons. And for people living out there with sickle cell disease is actually a hereditary disease that can be prevented. And this will be prevented if to-be couples know their hemoglobin electrophoresis. Actually, the teaching here is that if you're about to get married, keeping emotions aside, please get your hemoglobin electrophoresis so that if it happens that you have chances, just 25% chances of developing this sickle cell anemia, it's okay to part ways. But if you're going to be bringing up children with sickle cell disease,
Oh my
you
God, my
have
phone
to
has
be
gone
educated.
off. Jesus Christ.
You're going to need to be educated on how to go about with these children. Now, currently, the trials on stem cell technology, there are trials on how you can, on bone marrow transplant that can be used to treat sickle cell. These are ongoing. A select group of volunteers have actually benefited from this, but until these trials are validated for global consumption, all we have to do is preach the message of prevention, and prevention starts from to-be couples knowing their sickle cell status and also helping us to reduce its prevalence. All right. So basically, that is it. That is what I'll have to add. We lost Ms. Atem Nuela, and at this point, I'll be receiving questions from those joining us either on Facebook and as well on Zoom. So if you have a question, you can feel free to unmute if you're on Zoom and ask your question. This question is going to be heard live and we're going to answer it. I can see Conrad, hands is up, Marinel. So Conrad, you go first.
Yeah. What I want to ask is, it is known that the sickle cell disease is about 80% of those who suffer from sickle cell disease are Africans. And what I doubt is, I want to ask you, how is it really dealt in Cameroon, to be precise, or in Africa as a large? So, because I don't know if in Africa you have, or in Cameroon there's a particular drug that is used to combat the situation, or to manage it a little bit. So I really doubt if it's really manageable in Cameroon. Then yeah, so.
Thank you very much. Mr. Conrad, where are you talking from? Because you sound as if you're not from Cameroon. So just tell us where you're from so that I would know how to address.
All right. I'm in Belgium.
Okay, thank you. All right, so yes, here in Cameroon, we manage sickle cell disease. And we have, like I said earlier, we have a sickle cell clinic in most of our hospitals where we follow up these children and also adults who are living with sickle cell disease. And how do we go about that? They have routine prophylactic treatment that they take, all right? So I cited folic acid, hydroxyurea, and malaria prophylaxis that we give them. And also we have vaccines against encapsulated bacteria that we give to children after the age 5 to prevent them from having frequent infections that are caused by the damage of the genetic anomaly to the spleen, which is actually an immune organ. So yes, we do manage children who come up with this disease, and most of them are routinely on pain meds because they are always exposed. They always present with painful crisis. So pain medications might range from as simple as paracetamol or Tylenol, as what people have them, to as large as opiates, depending on the pain threshold of these children. So yes, we do manage them. The only challenge we have here, because we don't have a definitive cure yet in Cameroon.
So what does is it hydrourea or what does it really what does it do for the sickle cell blood? How does it help to improve standard of living?
Hydroxyurea is actually, it helps these patients to reduce their rate of recurrent crisis, right? It also helps in clearing of how will I call it? In simple form, the output of damaged red blood cells through the kidneys without causing so much renal injury. So it's actually a prophylactic drug given to children under the age 5 so that they don't develop complications such as kidney injury before that age.
Yeah, sorry. The last is I want to ask is, after all these follow-ups and all the medications given to those who suffer from the sickle cell disease, what is the lifespan or how long can a person live under all the medications, the hydroxyurea, the folic acid, and all those things for a long time? How long can a person sustain that for his entire life? Because when I see it and I read about it, I hear, okay, the average lifespan of those who suffer from sickle cell disease is about 40 something years. Like that's the standard. After 40 something years, you have a lot of other complications. So how long after taking the hydrourea and the folic acid and all testing of your hemoglobin, how long can it last you?
All right, so you said it. Current scientific studies reveal that the average lifespan of someone living with sickle cell anemia, it's approximately 41 years. That is the average. So currently in our cohort, we have someone who is at age 50. All right. So basically, I can't tell you outside what the current studies are saying, but in our cohort, we have at least 2 persons in their early 50s living with sickle cell disease. But these are extremes. I won't say everyone living with sickle cell disease can live up to age 50, but these are real life patients that we are following up. All right. But current meta-analysis, current scientific studies reveal that the average life expectancy of people living with sickle cell disease is approximately 41 years. So that's it.
All right, thank you.
Welcome, sir. All right, Madam Marinelle, your hand is raised. Right. So any other questions? If your hand is raised, you can unmute and ask, please.
Okay, thank you, sir. I'm interested with the prophylactic package. Like you mentioned, the hydroxyurea, the folic acid, anti-malaria drugs, like which ones exactly? Because we have so many drugs. And what others? The prophylactic package.
All right, thank you very much for that question. I'm going to actually say what we do here, right? It's not going to be the same with maybe wherever you are, but each hospital, each healthcare system actually adapts what they have as prophylaxis, right? So for our follow-up, we have folic acid, which is 5 milligrams. It's given on a daily basis. And these children will come every month, will have to refill this. Hydroxyurea is given at 100 milligrams, which is taken once a day, and they take that also throughout, right? We also have the malaria prophylaxis that we give for children. Is actually a combination of sulfadiazine pyrimethamine. That's a generic, and this is given every 3 months for these children. So basically, that is their prophylactic package and what we give here. So this might vary from center to center based on the availability of what we have, and basically that's it.
Okay, thank you.
Madam, I think every other, you can, it's okay for you to unmute and ask the question, please.
Please, Dr. Cynthia, while answering the question,
I can't get you.
or what?
All right, I have 3 hands raised, but I'm not getting the questions, please.
Hello. Hello. Hello.
No.
Yes. This is Ngala Blessing. I'm talking from Kribi. Please, while mentioning the prophylactic treatment for the sickle cell children, you said that there is no cure yet in Cameroon. I wish to find out if there is cure in another aspect of the world, such that at least we can be hoping and expecting that one day this cure will come by, such that it can be available for the sickle cell people living with sickle cell around us. Thank you.
All right, the current cure is still on trial, and that is stem cell transplant as well as bone marrow transplant. And as early as 2014, we've had volunteers who actually had a positive outcome. So it's still yet to be validated for public consumption, but we are hoping that in the years to come, it's actually going to be treatment. So yes, stem cell transplant and bone marrow transplant are on trials, and it's actually promising. But for now, it's just in a select group of volunteers, and it's yet to be validated for global consumption.
Okay. Thank God for that.
All right, so I have a question here in the chat section saying, what if you take herbal treatment for management of sickle cell disease? it's very interesting. It says, I've come across several adverts on complete cure with herbal medicines, but what do you have to tell the population about to manage it traditionally? All right, this is very controversial. All right, I can't tell you that there is a herbal cure for sickle cell disease because all of this is not yet verified. All right, and personally, I don't know of any herbal cure that someone has shown me that works for sickle cell disease. So the information to take home here is that we have several in the African pharmacopoeia that claim to have a lot of potency. And what we are advocating at Sciences is for us to be able to do verified studies on all of these potential drugs and actually see if they work or if they are causing more damage. So basically, that's what I'll have to say about herbal medications. They are not yet verified, and I cannot recommend somebody on that. But until we are able to have verified information or verified studies, scientific studies on that, on the African pharmacopoeia, we will not be able to, I personally will not be able to recommend it to someone. Thank you.
Doctor, I have a question.
Yes, go ahead, sir.
My question is, the sickle cell disease is suffered mainly by Africans. It is just a minority of those out of Africa who suffer from sickle cell disease, maybe the Middle East or the Asians. What I would like to think about is, I think if something like a cure is coming, is going to come about, is Africans should be the one to stand at the forefront to come out with the cure of sickle cell, because sickle cell is a very dangerous disease. It is very, very dangerous. Without medications, I don't think the child can even reach 5. It's very dangerous. And according to my findings, when I looked at things, when I looked at materials, when I read things, I do research, I find out about gene therapies. But those gene therapies are not made in Africa. Those things are researched and done in maybe in America, in Europe, and they are very expensive. There are lots of people, there are lots of kids who have gone through the gene therapy process and they've been cured of sickle cell. But of course, they have their $2 million to go through the process. But what I want to think about is the African woman or the African father who is in Cameroon, who is in Ghana, who is in Cote d'Ivoire, who is in Nigeria, who is watching the child suffer every day from this sickle cell disease, and I don't know what Cameroon or the rest of Africa is doing for research and development for this drug or for another drug or for a cure. And the other thing I want to say, there's no much of an awareness. Like, people don't know about it. There's a lot of people getting married anyhow. You just meet a girl today, you guys are the next day you are married, and it's silent because I myself, I didn't know about it. Like, I learned it one day in class, but it's not something like it's passive. But I bet you if you fall into that trap, it's a very, very big mistake that you can do. So what I'm saying is, I want to ask you a question. If there are research centers, because we can't as Africans, we can't depend on Americans, we can't depend on Europeans, we can't depend on them. We shouldn't sit back and just wait for a cure that, hydrourea from America to come to Africa, or folic acid to come to Africa. We just copy and paste what they do. So I want to ask if scientists in Cameroon, in Ghana, all over in Africa, they are doing something to combat this situation, because the situation in which those guys, even in Europe, and they don't do much of research in it because they don't really care. They don't really care. Sickle cell disease has been less research above all other diseases which exist today. There are no more research on it. So I don't know if you guys, doctors, scientists, researchers, you guys try to do research every day on it.
All right, so I would say from my own standpoint and from what I am well informed about, and the first thing is, yes, there are a lot of push for our own uh, facilities to be able to carry on ongoing clinical trials, but all of these most of it is still in a very conceptual state. All right. So yes, it's a fight for healthcare systems in Africa and Cameroon in particular to be able to push for this. And in as much as it is neglected by the world, it's also neglected a lot by our own healthcare system. And those of us starting campaigns like this is because we want to raise a global awareness. Yes, an awareness for the population. Because if you have to lead people, and if people know what they need, they can actually get what they need. So the scientists in the lab cannot do a lot without the people advocating for it. So basically, if all of us are aware of the risks of developing or giving birth to sickle cell children, and we can start as much as preventing it from even happening, and then we as a nation, as a race of people, we can advocate for our own facilities to push for a discovery to a cure, then I think we'll have a way forward. But as of now, the problem, like you said, people are not even aware. So we are still back, maybe even 15 years behind the other countries in creating awareness for just prevention of such a condition. And so I think this is timely or even late for us to be doing such online campaigns for people to get aware of this and for every to-be corporate to have their hemoglobin electrophoresis up to date before they get wedded. So basically, that is what I would say to you. And I would say as Africans in the diaspora, we would encourage that you also lead advocacy for this, because it all comes from the population seeking what they need to empower the entire world. And that is one way we can come out of it. But first, let's get 90% or 95% of Africans, Cameroonians, or the world aware of what this disease is and the damage it could cause if not prevented. And then deal with the people that are living with it and find a possible cure for them in the next 10, 15, or how many years we'll have to fight for that. Thank you.
Thank you, doctor.
All right, I have a question in the chat section which says, how can someone manage sickle cell crisis before rushing to the hospital? He said that pains can kill. Basically, these children have their routine pain meds. So once they have their crisis, they know how to prevent them. Now, earlier we gave lifestyle adaptations for these children. I will just reiterate one: stay hydrated. If you have a child living with sickle cell, get the child a water carrier. They should always have a water carrier with them. They should always have it filled and drink as much as possible. Help these children not to engage in unaccustomed sports. When we have extreme temperatures, cold or very hot weather, keep them in areas. If it's very hot, let them stay hydrated. If it's very cold, keep them warm, because all of these triggers actually predispose them to having this crisis. And if the crisis do happen, then get them their routine pain meds before they get to the hospital. So basically, these are things that you can do as a parent, as a friend, or as someone living with a disease to actually manage your crisis before you get to the hospital setting. Right.
Doctor, you mentioned hemoglobin electrophoresis as a diagnostic investigation for sickle cell disease. What other investigations do we have apart from hemoglobin electrophoresis? Thank you.
All right. Currently, basically, that's the baseline. All the investigations we do for people living with sickle cell disease is basically to assess for all the complications of the disease. all right, that we do. So basically, we run a liver panel, we run a renal function test for these children, and also we run a septic screen, basically doing blood urine culture to actually see if they have other complications that the disease presents with them. But the baseline for diagnosis now setting, it's hemoglobin electrophoresis, basically, that we do for them, and it's the basic that we do. Yeah.
Oh, thank you. Is it the one called Sickling test?
All right, the Sickling test, it was the first test that was done, but the Sickling test is actually not a diagnostic test, but a test that gives us, it's like a screening test. And the Sickling test was done, let me say, years back, where you exposed a blood sample collected from someone who is wanting to do the test and to low oxygen levels and see if it's actually going to develop a sickle shape. But that is not the standard of diagnosis for sickle cell disease. If we're going on a campaign in a very, very resource area, then we can adapt a Sickling test, but it's actually not the standard of diagnosis.
Thank you.
Are there any preferred meals and others that they should avoid completely? I won't say that there are no preferred meals, there are no restrictions for diet. We should these children should eat healthy. They should eat healthy, meaning that in non-communicable diseases, what we advise for a healthy diet, it's a diet where you take your plate of food like a circle and you divide it into quarters. The first two quarters should be filled with vegetables. It should be filled with vegetables of any sort that you want. So 50% of your plate should be vegetables. The other quarter should have a complement of carbohydrates, and the other quarter proteins. So basically, that is how your meal should be organized. All right. So we should encourage these children to eat healthy. There are no restrictions. They are not. We are not going to starve them from any meal or whatever, but they should eat healthy and also stay hydrated. More veggies is very important for them, and basically that's it. Right. So if we don't have any questions again, we're going to be wrapping up this session in the next 7 minutes. It will be an hour exactly. So we're going to be wrapping up this section if there are no questions.
Dr. Nge, does alcohol have any adverse effect on sickle cell?
Yes, it does. It does. What it does is that it causes more damage or increases the level more damage to the liver, which is already laden with a lot of infections from the red blood cells. And we want to tell them not to consume alcohol. Let them take water. Water is good for them. Let them drink as much water as possible. But alcohol, it's not advisable for people living with sickle cell disease.
Right.
Right. So I'm doctor, and I'm also standing in for Mr. Cameroon for the United Nations. It's a beauty contest, all right? But I'm going in there as medical doctor to promote the third Sustainable Development Goals for good health and well-being, and I'll be promoting non-communicable diseases. This session was hosted by the first runner-up for Miss Cameroon 2021, and we are trying to use beauty to serve health. And for me, even in current times, if you go back when you close, you check the number of followers for WHO or the CDC and compare with the number of followers for maybe any entertainment events, you find that it's like day and night. So we are trying to, personally, I'm trying to move from staying in the hospital always to getting out to the population and helping them stay healthy. If you are going to be on the beauty show and you find me promoting health, I think you pay attention to it. But most of these beauty shows pass without anything empowering to us. And it also gives us an additional risk factors of staying sedentary. So the objective of me engaging in a beauty contest was actually to help beauty attain a certain level of promoting health. And so I'll be inviting you all to stay glued to our pages, and we'll be inviting you to vote for this team. Welcome back, Miss Adem. We lost you.
So sorry. Oh,
Right.
my phone was off.
Right, so it happened. So I've been answering a couple of questions from our followers, and we are wrapping up. And what I was saying is that we are actually promoting health using the umbrella of a beauty contest, and we'll be inviting you to support us during the time. And you will receive the alerts if you are following our pages. Don't sit back. As for those of us who want sickle cell disease to be on a state of debate in very, very strong places, this is an opportunity for us to give in our support and help people stay healthy. For those of us who want non-communicable disease to be on a debate, for funding, most especially because we have people living with diabetes, hypertension, they all pay their drugs out of pocket, right? But I think that if more advocacy is done for these people, a lot can be done for subsidies for these people living with this non-communicable disease, because they are going to stay with it for life, but they need they need a lot of support. So on this note, we'll be wrapping up the session. I don't know if there are any final words from any of the attendees here, and then we're going to call it a day. Right? So we take it that there are no additional questions. Feel free to private chat us, leave a question in the links online on Facebook, and even through our private channels. We'll be answering to questions after that. I want to wish everyone a healthy week ahead. We encourage you to stay safe, get vaccinated, and above all, stay healthy. God bless you all, and we'll be seeing you hopefully in the next online session next week or a week, 2 weeks from now. Thank you for coming, and stay healthy and stay safe.